Welcome back to the chat. I'm Dr. Pascal with Dr. Dan here. Today we want to address a common question, or really more of a statement that we hear from patients quite often. And that is, Doc, I'm getting some back pain. My mom had a bad back, or my dad had a bad back, so automatically it means that genetically I'm doomed to have this type of pain or to have this type of problem. So today we kind of want to break down that misconception that just because somebody in your family had a bad back doesn't mean that you're doomed to lifelong chronic back pain. Right.
So one of the things that, yes, there can be a very small genetic component where there are some times where, whether it's especially a scoliosis or genetic changes to the spine that a parent, may pass down to a child, but that is a very small percentage of the population. A lot of times what really people are talking about is, oh, my dad, since I could remember, would shovel the driveway and be complaining of back pain forever, and now I'm feeling it. Is that just a genetic kind of, gift that my parents gave me? And the answer to that is no. A lot of times we are doing things very similarly. We're doing things that our parents do, whether it's the lack of things that our parents do, or we do too much of what they've done, like things like too much sitting, not enough stretching, lifestyle habits, all these things, and we inherit those and we start to develop the same things that our parents developed.
I mean, the perfect example is when you look at identical twins, especially if they're split at birth. Yep. Right? And then so if for some reason those twins are split at birth, one develops back pain, one doesn't. Mm-hmm. One develops a scoliosis, one doesn't. Well, they're identical. Their genetics are identical. Yep. So what differed between the two of them? It was basically the lifestyle habits and things that they were exposed to throughout life that then dictated whether or not they developed these spinal problems or spinal conditions. And so when it comes to chronic back pain, it's no different than any other chronic health condition, right? Maybe your mom or your dad had type 2 diabetes. It doesn't mean that you're going to get it. You will if you adopt the exact same nutritional behaviors. But if you take, better care of yourself and you eat differently, it doesn't mean that you're going to get type 2 diabetes at all, right? So it's lifestyle choices that will prevent us from developing these same conditions that we might be predisposed to, but we're not doomed to get them.
Right, and that's a great example of saying, well, my dad has heart disease and I now am showing early signs of heart disease as well. It doesn't mean that you have to keep going down that same route. You have actions that you can do right now to change that course. You could change what you're eating, how you're exercising, all those things, and all of a sudden you could continue to go and see the doctor, and then all of a sudden they've said, actually now you're no longer a risk for heart disease. But the same thing could be true for the back and to the spine. So meaning that now I'm starting to feel pressure and pain in my lower back just like my parents do, but now what can I do right now? What actions can I take to change the course? So that's exactly what we want to do with our patients, to say, okay, so this is where you are now, this is where we want to take you, these are the steps that you need to do in terms of stretching, exercises, lifestyle habits, adjustments that we could do to change that course, help you and feel better faster.
So I think one of the very first ones, and I think one of the most impactful ones, would be obviously movement, right? The more that you move, your spine was designed to move. And the spine that doesn't move becomes fixated. So the joints kind of get gummed up, they get locked up, and they stop moving. Anytime two vertebrae or two joints in the spine stop moving, they're going to get more what's called scar tissue and fibrosis. They're going to become stiffer, and as that joint becomes stiffer, it starts to degenerate, which is aka arthritis, by the way, and that joint will continue to break down. And then so you might hear, my dad had arthritis, I have it. Well, what's happening is the spine is breaking down because of improper movement. Now that movement can come in one of two ways. That movement can obviously be just global body exercise and getting us moving, that helps. But when we're specifically referring to joints that are fixated, to joints that don't move, that's where we need a specific chiropractic adjustment to regain proper motion at that segmental level so it doesn't break down further.
Right. And absolutely, you're right. We have to, there's, like you talked about, global movement, but segmental movement. That's exactly what we do as chiropractors. We want to make sure each of those joints are moving. But the other key thing is just spinal movement that we give our patients in terms of, like, the mad cat, the cat cow, the all these different stretches, your Denarules, all those exercises that you're doing at home dramatically increase that intersegmental movement to make sure that things don't break down. And like you're saying, just stiffness on its own is going to cause your spine to degenerate faster, aka the stiffer you are, the older you will get faster.
So when it comes to exercise, like one of the things that we know about protecting the spine and protecting the discs is we actually want to lift weights. Like we want to do moderate weight lifting or moderate what we call resistance training quite frequent and quite often. What we want to avoid is like fast aggressive loads. And so like I don't do anything, I sit at my desk all day, and then someone needs help lifting a 200-pound log out of their yard and I haven't done anything all day and I bend over and try and lift, I'll hurt my back. But to protect the discs, we want to be doing this type of resistance training to strengthen those discs and strengthen the core kind of over and over consistently.
Yeah, like I think what you're kind of explaining too is the weekend warrior, where you do nothing all week and all of a sudden you do everything on the weekend. But that is a recipe for disaster, because the spine is not ready for the load that you're going to give it. Whether it's hockey on Saturday mornings or moving things around the yard, you want to be consistently taking care of your spine, your muscles, your discs, your joints by doing some form of regular movement.
So we have obviously chiropractic adjustments for movement at specific joints. We have overall global spinal exercises to get all the joints moving. We have strength or resistance training to build up the core and the stability. And then number 4 is going to be nutrition. Nutrition is huge. And I mentioned, like we talked about diabetes or type 2 diabetes. Funny enough, the same dietary patterns that will lead you to get type 2 diabetes, eating too many things that are white or refined, like rice and chips and pasta and crackers. All of those white things will raise your blood sugars, but interestingly, they also cause something called glycation to your disc, which is basically like, sticky white stuff, if you will, that causes the disc to become brittle. And as that disc becomes brittle, well, over time, it's going to get hurt. And then as it gets hurt, it begins or continues to break down. And so the more, sugars we eat, the more we have glycation in our body, the faster those discs can break down. And that's why you've seen it. Someone maybe in their 30s comes in and they've got a degenerated thin disc that looks like someone that should be in their 70s, right? And that person believes that, well, again, it's hereditary because my dad had the same problem, right? And so nutrition is huge. And so we want to focus, obviously, on trying to reduce refined foods, eating more whole plant-based foods, eating a whole foods diet as opposed to eating refined sugary foods.
Yeah. So hopefully those 4 key things help you understand a little bit more that you actually have more, a bigger role in terms of how your spine will age over time. You have a bigger role in helping yourself be as best as you possibly can be. Again, if you need any help or if you need any guidance, reach out to us here at Lindenwood's Chiropractic. That's 204-474-1159, and we'll see you soon, and enjoy the rest of your day.